Wonderful. All right, can everyone hear and see us there? Just give us a little thumbs up if you can. Fabulous. Thank you so much. Welcome to our second August Aqua Bites this month. We're got a double header. So before we get started, before I introduce everyone, I would just like to acknowledge the traditional owners and custodians of country on which we're meeting today and pay my respects to the Whadjuk people of the Noongar Nation. I would also like to pay my respects to elders past and present and extend that respect to all Aboriginal people in the room and online with us today. Lovely. All right, well, welcome, Charlie. Thank you again for joining us. And we will pop those up as well. All right, so you're okay to go off there? I think it's fine. If you're happy to go ahead, we've got those both there. Lovely. Take it away. Charlie's going to take us through some HPV.
Hello, and thank you for attending. Thanks for having me, Liberty.
So let me just look into. Sorry, that's my one's yours. Maybe just see what's going on here. Why is that not changing? So sharing.
You can open it up.
Yeah, hang on. We're doing the sharing. All right, there we go. Beautiful. So if you just use that one there, Charlie, then that will take us through and hopefully it will all keep talking as well.
Okay, let's try this.
Nice, perfect.
So my name is Charlie and I'm the immunisation educator at AHCWA. I sit on multiple meetings relating to infectious diseases and immunisation and assist in the health promotion to our various communities in WA vaccinations and teach a vaccination training course to Aboriginal health practitioners and Aboriginal health workers. I'm a registered nurse of English and Spanish heritage and love calling Australia my home. I'd like to pay my own respects to the Whadjuk people of the Noongar Nation for sharing their land, waters and community that allows me to call Perth my home, and to all the Aboriginal and Torres Strait Islander people who have gone before me and used medicine to heal, shared their knowledge through teaching to better the next generation's health and longevity. So, why this presentation? So in some of the meetings that I've been to, there's been shown to be a significant drop in vaccination numbers against HPV. If vaccination numbers are down, it means that cancer numbers will be going up. And some of the physicians involved in this are concerned that we're almost at a crisis point with the lack of vaccination. As you probably already know, HPV is directly linked to causing cervical cancer. And cervical cancer affects and kills Aboriginal and Torres Strait Islander people more than non-Aboriginal Torres Strait Islander. And we do have a vaccination that can protect against 90% of those cervical cancers. And all of us as practitioners, parents, aunties, mothers, friends, we all need to sort of start to help a bit more with this so that it doesn't reach that crisis point. So some of the data to be presented, if we look at all adolescents in Australia, the coverage by their 15th birthday has continued to decrease since the onset of COVID, as have other vaccinations. But we've seen the biggest declines in the last couple of years, and in boys especially. If that's broken down to Aboriginal and Torres Strait Islander adolescents, again, it's a significant drop. And we know that Aboriginal and Torres Strait Islander people in general are more susceptible to HPV and then also the related cancers. Just showing again here the decrease, but in terms of state by state in Australia, WA unfortunately is quite low compared to the others, but Australia-wide we all need to do more to increase these rates. So years ago, there was a move by the World Health Organization to set about a strategic plan to eliminate cervical cancer. Australia took on board the same kind of strategy, and we were hoping to achieve cervical cancer by 2035. We were certainly on track, and we were going to become the first nation to rule out cervical cancer due to this program. But unfortunately, COVID came along and has changed that. You can see a little bit more in that strategy, the WHO targets and MENA targets and how we're going to achieve it. And that's available if anybody wants to read any more about it. So that was in 2021 that the Minister for Health announced a collaboration with the Australian Centre for the Prevention of Cervical Cancer to develop the strategy to eliminate cervical cancer. It was funded by the Australian government, and we were looking at an Australia where preventable cervical cancer is a disease of the past. And that included diverse communities having equitable access to information and culturally safe and inclusive vaccination, screening and treatment services. So we're not on track. So in Perth, the government decided that we needed to do a bit more, and a project called Stay Safe, Stay Mooditch was launched. It was a two-part project. The two photos or images on the left of your screen were the first part, where a group were brought together to try and make this a community-driven promotion. We had TikTok videos, and now in the second part, in that first part it was more aimed at adolescents and preteens, whereas this second part is more towards parents and carers of adolescents. So the two images on the right are the draft forms of what we're developing at the moment, so stay tuned. So what is HPV? I'm sure you all know, but we just refresh on it for those who may have foggy memories like mine. So HPV stands for human papillomavirus. So papilloma are warts. It's extremely common and very contagious virus. Around 90% of Australians will get HPV at some point in their lives, and they may not ever know, as there are usually no symptoms. There are many types of HPV, over 100, and I believe there are more being found. It affects the skin and the mucous membranes. It can lead to warts, cell changes and cancers. So most are cleared by the body within 1 to 2 years, but some can stay in our systems forever and lie dormant. HPV is the virus that directly causes most cervical cancers. How is it spread? HPV is spread by skin-to-skin contact via tiny breaks in the skin. Genital HPV is spread through intimate genital contact. Individuals can be exposed to HPV as soon as they become sexually active, even with just one partner. And people may not even realise they have HPV, but continue to spread it. Obviously, people with multiple sexual partners are at more risk of developing HPV. And it's not very common, but sometimes during pregnancy, HPV can be passed on to the newborn child, and that can lead to a dangerous condition in the child where it develops into the respiratory system. So HPV symptoms, most infections of HPV have no symptoms at all. There are different types, and they're classified into low risk or high risk. Low-risk skin warts are commonly seen on the hands, feet, knees, elbows. They can show up as flat warts on the face, pretty much anywhere where there's a breach in the skin. These skin warts can be removed physically with creams and burning, but the virus remains. Low-risk genital HPV types, there's approximately 50, including types 6 and 11 can cause genital warts and be found on the labia, vagina, penis, scrotum, anus, groin, skin around the anus and urethra. They can be internal on the softer, more moist mucosa or remain on the skin on the outside, or both. If it does show up as genital warts, they can be smooth, flat, bumpy, or they can look cauliflower-like, like in some of the images there. They can be pink, red, white, grey, brown. They're usually quite small, but can clump together in groups, forming like sort of a plaque. The warts can be painful, they can be itchy, they can bleed, or there can be no pain at all. When they're on the mucosa, you can see in the images on the right-hand side there near somebody's teeth, in the first two, and then on the bottom one there at the back of the throat. So they can be found throat, gums, larynx, respiratory tract, and low-risk respiratory papillomatosis, which can be spread to the newborn baby, is characterised by multiple warty growths on the mucosa of the respiratory tract.
Wow.
High risk types. So that's including types 16 and 18, have a higher risk of significant cell changes which can progress to cancer if they're not discovered and treated. There's a further 11 types that are classified as carcinogenic and some that are probably carcinogenic. Infection with these types of HPV remain in the body for a long time, and the cancer can take up to 10 years to develop. So we know that some HPVs cause cancer. How it does that is the virus can cause changes to the particular cells where they invade, and they're called precancerous lesions that can eventually lead to cancer. HPV causing cervical cancer as the most common, and as you can see there, more than 95% of cervical cancer is due to HPV. So if the virus hasn't cleared on its own in the body and remains a persistent infection, it can cause the cells in the cervix to change, which can eventually develop into cervical cancer. Cervical cancer is the 5th most common cancer among Aboriginal and Torres Strait Islander people who have a cervix. And Aboriginal and Torres Strait Islander women are 4 times more likely to die from cervical cancer than non-Indigenous women, which is, both those stats are quite large. In the early stages of cervical cancer, there are often no signs and symptoms, but people may notice some bleeding after sex, pain during sex, abnormal periods, vaginal bleeding or discharge, pain in the pelvis. Malignant transformation in the cervix, so turning into cancer, usually occurs 10 to 20 years after infection with the high-risk types of HPV, but can also and has also been reported within 2 years. So cervical cancer is very serious and can be life-threatening, and especially because the symptoms don't often show until the disease has progressed. We have amazing cervical screening tests here in Australia, which looks for HPV in the body. A negative test result means that the test didn't find any HPV in your sample, and you'll get a reminder usually 5 years after to return for a screen again. An inconclusive test result doesn't mean anything is wrong, it just means that they couldn't read it and you might need to go back for another test in a few more weeks. A positive test result means that HPV has been found. It's so common and it doesn't mean that you have cancer. You just need to be watched a little bit more closely. Other cancers from HPV can be vulvar and vaginal cancers that are caused by HPV. There's no routine screening tests for these cancers. Anal and precancerous lesions, 90% of those are caused by HPV. There's no routine screening tests for anal cancer, and 60% of oropharyngeal cancers, so throat, tongue, neck, tonsils, larynx, pharynx, are caused by HPV infection. And I guess if you think about it, the tissue that you find in the particularly in the vagina and cervix, is a similar type of tissue that's found in the mouth, the soft palate, the tongue. So it kind of makes sense. And I believe it's quite a new recognition that there was a relation between HPV and the cancers of the oropharynx and head and neck. There's more coming. I'm sure they're going to find more, which isn't great. And there is no treatment for HPV. So it's responsible for all those cancers, but once you've got it, there's no treatment. So you don't know how it's going to show up. We will all most likely get HPV if we haven't been vaccinated. We are all therefore at high risk of getting cervical cancer or other cancers related to HPV. And it means that we will wait with nervous anticipation to see if it does show up, or for our cervical smear test results every time. But there is an answer. There is a vaccination, and we need to get this back on track. It is only one needle, unless you've got immunocompromised state, but it's highly effective at preventing HPV-related illnesses. Cervical cancer, therefore, is one of the most preventable cancers because of this vaccine. It was first included on the National Immunisation Program for girls in 2007, and boys were included in 2013. Gardasil 9 was introduced in 2018 and is now a one-dose only vaccination on the schedule. And studies demonstrate that a single dose of HPV vaccine provides protection up to 11 years after vaccination, with studies ongoing. So one needle given in the upper arm in a tiny 0.5 ml pre-filled syringe, given to ages 12 to 13 or year 7. And it is given at this age, which seems very young, and it's one of the barriers that we seem to face with this vaccination. But this is because you can't give the vaccine and expect protection once someone's got an HPV infection. The like childhood immunisations, vaccines, are planned at times to be given before contact with the disease that they are protecting from. So age 12, year 7 has been chosen to be the best time to have the Gardasil 9 vaccine, as it is well before someone becomes sexually active, although there are exceptions. And school just makes it a convenient place to capture this age group. Anyone who misses out on this can always have catch-up. It is also available at some pharmacies, GPs, AMSs, etc. It's for all genders. It's free for anyone 12 to 25. Provides long-term protection from HPV. Protects against 9 types of HPV. Types 16 and 18 are the 2 types that cause most HPV-related cancers. Also includes 5 of the next most common HPV types associated with cervical cancer, and 2 of the non-cancer causing HPV types, which will cause genital warts. The ingredients are proven to be safe and are continually monitored by the TGA. Side effects are no different to any other vaccination. Some pain, redness and swelling at the injection site, maybe mild fever, headache and nausea. Contradictions are very similar to all other vaccinations as well, only not to have it if you've had anaphylaxis after a previous dose of any HPV vaccine, anaphylaxis after any component of an HPV vaccine, anaphylaxis to yeast. Pregnant women can't have it, but otherwise a very well-tolerated vaccination. One of the vaccine barriers that we're seeing is people want to know that the vaccine is safe. When you look at the ingredients, it looks terrifying. You can see the 9 proteins on the left there. On the right, I've got some details of the chemicals that you can see within the ingredients. In the middle, there is a great resource on SKAI, which shows in nice simple terms what's included in a vaccine. And so some of these frightening looking chemicals on the right are included in that explanation. We also have incredible monitoring in Australia, and if there is a dangerous chemical in there, it is in such minute doses that it cannot be harmful to humans. So the barriers to HPV are similar to the other barriers to other vaccinations. Low school attendance has become an interesting problem since COVID, but there are other ways to get kids vaccinated against HPV, as I mentioned before, pharmacies being a really convenient way. There's also needle fear, with there's ways we can get over that as well. Vaccine fatigue, again, since COVID, mistrust of healthcare providers, misinformation. So we need to make sure the information we are giving is from a trusted resource. People still think HPV is an STI, and why does my 12-year-old need to have protection against an STI? They're too young, so it's another barrier that I spoke about. Cultural safety and sensitivity can be a difficult conversation to have with Aboriginal and Torres Strait Islander people, or anyone really. Safety of the vaccine, as I mentioned, getting consent is quite a problem. We need to help people get consent signed and returned, or look at another way of consenting, perhaps with mature minors. Engaging teens has been quite difficult. Social media posts, TikTok in particular, seems to be the standout way to engage. We also need to spread understanding of HPV and the cancers and the direct link that it has and how we can protect from that. That missed vaccinations need to be caught up. We need to face awkward conversations. We need the school to be supportive, and we need the health and education departments to connect, because that is quite a barrier as well. So how do we help somebody decide on a vaccination? Well, ultimately we can't decide for anybody, but we can present scientifically proven information and direct people to trusted sites to give them more opportunity to educate themselves. By keeping it simple, it's always a good idea. And even by looking at this list of pros and cons, it can provide a very powerful visual message. And I hate to say it and make it too obvious, but it just seems like a no-brainer to me to get this vaccination. Awkward conversations, it can be awkward for parents, carers, it can be awkward for some of us working with teens or with parents, but you know, there's always ways to go about it, and there's always help. I found some great resources on the Raising Children Network, and they talk about starting with some of the easy conversations, just a general yarn, just see how much people know, determine the level of understanding. Make sure you're ready before starting the conversation, and know where to get help for you and for them if it gets too awkward. And if you're advising a parent, you can also steer them towards support with that Raising Children's Network. They may not have had a sex chat at home. They may feel embarrassed talking about it. So they need to be given a bit of help from us to get through those conversations. And what can you do? Well, we really need to push this. So you really need to stay informed. If you want to know more about it, there is so much information, but you do need to make sure you find it from trusted resources. We should be asking all adolescents and preteens that we come in contact with if they are up to due with their HPV vaccination and the others, and encourage them to have it if they haven't. We need to talk about the HPV vaccine, its incredible results, HPV and its relation to cancer. We need to promote the vaccine in our place of work through posters, social media, recalls, etc. Promote it at schools, health services, community centres, football matches, school fetes, athletic days, and make it fun. We try and engage teenagers. They want something in return for doing this for us. If we can make it a fun day at school, a free dress day, a sausage sizzle. We need to take the time with people to yarn, allow them to ask their questions and guide them gently. Reduce fears, whether it's needle anxiety, the ingredients, the safety. Promote cervical screening, promote the use of condoms. Educate people that the screening has changed and you can do self-collection if they're uncomfortable. And we need to keep the ball rolling. We can't give up on this. It really is possible to get back on track with our strategy if we can up these numbers. I just provided here some resources. As I said, there's so many in different levels. There's people's stories, as you can see at the bottom left. There's advice on the vaccine, the disease, support, screening, and we can add these links in the chat afterwards if you like. And just so you know, AHCWA are developing resources that are in draft but will be ready to go hopefully soon, and we will share them with you all. But please, in ending, help everybody stay safe, stay motivated, and let's promote this life-saving vaccination. Thank you.
Beautiful. Thank you, Charlie. Do you mind just minimising your screen? We'll bring it up there. Lovely. So we've got a few more minutes here. So I'll just stop sharing there. Has anyone got any questions for that one at all? I will just pop a little QR code just quickly up as well, if it will let me. So if you do have a moment just to give that a quick little scan. What's going on? Tell you what, me and the old. Hang on, let's do this one. Stop sharing. And this one, hopefully. If not, I will send it out a little bit later. That's no worries. Anyway, has anyone got any questions in the chat? Anything pelvic pain, anything HPV related? Fire away now. Otherwise, we will wrap it up. Just like to say another big thank you to Charlie and to Emma. Again, thank you for joining us. Thank you to everyone out there for joining us. I will send these links out as well and include all those emails and resources as well from the ladies. So thanks again. Wonderful. Thank you. Lovely. Thank you so much. All right, guys, we'll be in touch soon.